Rashida Tlaib admits she only wears a mask for cameras. I'm just wearing it because I've got a Republican tracker here. Hi, I'm Matt Logan. Welcome to another podcast of Shh, It Matters, where we are going to just give our opinion on the latest news. Hanging out with me to my left,
Craig Uglin. You can find me on Facebook and Instagram.
That way when we switch cameras back and forth, you know he's on my left, like that matters.
It does matter.
It does matter. Left lives matter.
Just ask him. I don't know what that means.
I don't know. I don't know what it means either, but here we go. Let's do this. Representative Rashida Tlaib of Michigan, a Democrat, thinks masks only need to be worn if someone is there to catch you without one, according to remarks caught on video during a Detroit community event. She's actually at a urban development event, so the Housing and Urban Development event, HUD, as everyone knows it. And the Secretary, Marcia Fudge, on Monday was talking about after doing an event with them at they were having a conversation. Looks like maskless, and a maskless attendee who mistakenly thought the Democrat scolded him as being the one unmasked, right? Tlaib responded by insisting she only wore a mask because a Republican tracker was recording the exchange. Oh no, not you, Tlaib said, as she pulled her mask away from her face. No, I'm just wearing it because I've got a Republican tracker here. Just weeks before the event, the squad, quote, member faced criticism when she danced maskless at a crowd in an indoor wedding in Dearborn, Michigan. The video surfaced on the same day Tlaib slammed Senator Rand Paul, a Republican in Kentucky, for urging his followers to resist the Center for Disease Control and Prevention masking guidelines. Tlaib attended the wedding days after the CDC recommended wearing masks indoors regardless of vaccination status in local areas with high community transmission, and categorized that applied to Dearborn at the time. Woo!
Do as I say, not as I do.
You know, here's the thing is, the list goes on and on. AOC, Alexandria Ocasio-Cortez. Also, I've seen this photo. In fact, I saw the photo and the video of what she did with her mask. She literally put the mask on for the photo only. Mm-hmm. And someone was in the background recording it, so it wasn't like just photos of seconds. A couple of times, what's his name? John Kerry talks about in here that he's been on airplanes and in airports without a mask and kind of resisting that. Talks about Elizabeth Warren, how she partied indoors without a mask at an Interior Secretary's wedding in August. We could talk about Obama's birthday. You know, there's a lot of stuff here that we could cover. People.
They're not leading by example.
They're not, are they?
You know, once again, we are talking about COVID, and if they expect all of us heathens down here to abide by their rules, they should also abide by the rules, or at least when you know that they're out in public. You know, do what you want in your own house, I guess. But you know that social media, you know that cameras are everywhere. So why are you trying to get away with not wearing your mask?
You know what it says to me, though? It says to me that literally us little minions down here doesn't matter.
No.
Just like you said, do as we say, not as we do. Right. Rules for thee and not for me.
Right.
We are the elites.
And this is, you know, examples of this are why people are second guessing what's going on with the viruses and all the mandates. If it's that serious, which it is serious, but if it's to the extent that they say it is, why are these public figures not following what they're telling us to do? If it's truly that bad, they should be very scared and be very cautious of wearing their masks everywhere.
Yeah, they should be. And clearly they're not scared because the percentage of people who catch COVID and it's still, I think, a 99 nationally a 99.7% recovery rate.
Right.
I mean, yes, there are certain people who get COVID that is extremely serious, and it leads to their death, and that's terrible. And I don't want to say but so does pneumonia, so does the flu, so does a car crash, so does, and I could keep going, obviously.
Heart disease, diabetes, all of
smoking,
it. Yeah.
the diabetic issues that we have in this country, so the focus, again, is just so much on one thing and not on the whole health of a country. It's clearly not that. It's clearly I mean, when you come out and say, "Oh, no, it's not you. I'm only doing it because of these cameras and it's Republican," there's something seriously wrong with that narrative.
Right. And this from a person that is attached to the group that's pushing this stuff.
Right.
The squad or whatever their nickname is.
Yeah, I know.
They're pushing all these extreme ideas. Not that masking is an extreme idea, but they're wanting us to do their will. They want all of us to listen to them and do everything that they tell us to do. Yet,
right.
There you go.
Yep.
So
it's interesting, the mask thing, and you see even when they are wearing a mask, it's not worn properly. They're not clearly not like even an N95 mask. So many of them have like the surgical cloth mask that literally is not going to trap a virus. I mean,
no.
Let's say it's 2 or 3% of it, maybe. Okay, there's a little percentage there, I get it, but now it's in the mask and you're touching it because it's irritating your face like crazy. You're pulling it down and sticking your finger up your nose because your nose is running, and I mean, not quite literally, but you're touching your face a lot more,
right,
with a mask.
And I've touched on this before, and maybe the science has changed, but when everything hit the fan in 2020, my wife works at the clinic, and she's pretty in deep with this stuff, and she's in procedural suites where she's wearing full scrubs and the N95 masks, and they have to be fitted, I believe, twice a year because everybody's face is different. So they have to be fitted. So you can't just go out, buy one off the shelf and expect it to meet its full potential. Kind of like shoes. Not everybody wears the same size shoes. Not everybody wears the same size N95. And one of the things that she had mentioned was all the beards disappeared, because the beards keep the masks from fitting tight to your face. So it almost, I giggle when I see people with these big bushy beards and they have this mask on, and it's like there's some really funny analogies that I could go to, but this is a family show. I guess they're trying to make people feel good by wearing the masks, but they're not doing any good.
No.
Your beard is holding your mask away from your face, an inch. It's not doing any good. I mean, the beard will catch some chunks, I guess, but
exactly.
Yeah.
Yeah, and so that is the thing. So when you look at the science of it, okay, you could look at. So here's the thing that I haven't seen yet, and now maybe we have something, but a real life human study. They've done things in like a lab, but that's rigged.
Data in, data out. We've talked about that time and time again.
Yeah.
You can alter your data in your science to fit your agenda.
Right, and so
it's very easy to do.
So let's think about a chart I just saw, and I should have pulled it up here, but a chart that I had seen. It was Nevada and Arizona, and in July, Nevada went to a mask mandate again, and Arizona did not. When you look at the actual cases of COVID, now go out and look for this, please. Like we say every episode, go do your research. But Nevada's numbers were higher than Arizona's for COVID cases. it tracked, you watched it track, and it was higher. So that's a real life human study, essentially. Now, sure, the numbers might be a little bit different as far as population and some of those things. You could argue the point that Nevada has, obviously Las Vegas, it's a concentrated city, but there's Phoenix, that's a concentrated city.
Huge
all kinds of those types of things, right? So the cases, though, and the argument for that I would say about Las Vegas is there's people coming and going all the time. So their cases would be going to other states.
Right. Or other states bringing it in.
Yep.
Where Arizona, you're going to have your snowbird population, and probably a larger vulnerable population because of the average age likely being higher than it is in Vegas.
Correct.
Because of the snowbirds.
Right. Correct.
Yep.
So then you track it for myself. I would track it to the point of saying, okay, that's a real life United States human study. The cases. One state masks, one state not masks. So then where I would go with this is that when you see the people that are pushing this agenda not wearing the masks in indoor spaces, large crowds, they know the science that's true and real with it. The masks don't work, therefore they don't really care.
Right.
But they want that agenda to be pushed, and they want that control to be maintained. In my opinion, it's an opinion show. Remember that,
Right? Well, and Rochester has an interim superintendent, and at this week's school board meeting, they discussed requiring vaccines in the teachers, and the Rochester School District said because the rate of vaccination is at 88%, they thought that was high enough where they were not going to require their teachers to be vaccinated. And the superintendent is talking about this on the dais at the school board without his mask on. And the school board president is 3 feet to his side. Of course, then the next day or the day after, the governor was mandating it. So maybe he had a heads up, and that was his, I'll be protected. I'll make a few people happy, but I know the governor's going to overrule it. So I don't know what the result of that is, because of the governor, if all the school teachers are going to have to be vaccinated or not. But I just thought it was interesting that he's talking about all this not wearing a mask.
And that's a good point. Like this article specifically is saying that they move the goalpost all the time, and so radically and quickly, right? It's not just a slight move of the goalpost. It's a radical move, and it's a quick move.
Maybe that's the problem with the Vikings, is somebody keeps moving their goalpost.
Since the 70s?
Or earlier, yeah.
I think 70s was the last. But
we don't need to go down.
No, we don't. Anyway, so the point is, in my viewpoint, they're really trying to just maintain control. They want to come up with all these rules, and it doesn't apply to them once again. Like Obamacare didn't apply to Congress or anybody that worked for the government, and all those other things that are happening. From a federal standpoint, the legislatures and Senate and all those, they're not required to get a vaccine or anything like this, but they're pushing the mandate federally on all others. I know there's a lot of controversy on the post office, whether or not they're going to have to be vaccinated. It's been
strong union.
Right, it's been back and forth, all those kinds of things. And so the point of it is that they don't clearly believe in their own personal narrative. And so that is pause for me.
Absolutely. And it raises those red flags. If this is the end all be all answer, because they're requiring anybody that provides Medicare to Medicare. That's why the Mayo Clinic had to require vaccines for their staff. Require all the immigrants to get it, or all the people jumping the border, say. Let's go extreme. If you're going to require people that provide Medicare, how about you require recipients of welfare and food stamps?
Exactly.
Why don't you require them to get vaccines?
Exactly.
You have a captive audience, and they want what you have, money or assistance, so why not make them get it?
That's a good point.
Before they can cash that check.
Thanks for joining us this episode. We appreciate it. Make sure that you hammer out the like button, hammer the share button. Go ahead and hammer out a comment to us. We will see you on the next episode. Craig
Ugeland. You can find me on Facebook and Instagram.